One of the things that we have to deal with patients and even with ourselves is the sense of loss. And Elizabeth Kubler-Ross had developed the 5 stages of grief, which is what we kind of expected patients, not patients, but family of patients to go through when the family member was lost, or the patient was lost. When somebody died, we expected the family, friends to kind of go through these 5 stages of grief. And we found out that not all people go through all 5. They don't go through it at the same rate. There's a little bit of variation. So there's some debate about how accurate are the 5 stages now. But in general, you'll see these. And it's not just when somebody dies. It could be with any loss or any sort of disruption of your day. So we see our patients and our families in this frequently. And you've experienced this yourself. Imagine you're leaving the store and you trip something, you drop your phone, it hits the floor, and first thing is like, ooh, and then you're thinking to yourself, hopefully it's okay. You go to pick it up, you're turning it over, and you're like, I've got a screen protection on it, I got a case on it, it's gonna be okay. And then you turn it over and you look at it, and you see it's cracked. And it's cracked, oh no. Please, just let it turn on. Please, hopefully it'll turn on. So you start pressing buttons and touching screens and seeing if you can put in passcodes and all that. You just want it to turn on at this point. Yay, thank goodness it turned on. Okay, I'll be really careful with it from here on out. I'm never gonna let that happen again. You're making this sort of bargain thing. And then you have to look at this cracked screen. And of course, we're a little angry about that, and we're a little frustrated with that. And sometimes we even sort of get depressed with it. You just had this $1,000 device, and you've dropped it, and it broke. And eventually, you're like, well, just got to live with it. I don't have another $1,000, so you live with the crack on the screen, and eventually you're okay with that, and then the new phone comes out, and you want to go get that one. So we see patients that go through these 5 stages. And a lot of times, there might be some denial about what is happening. And one of the kind of classic cases with this is someone that's having chest pain and is having a heart attack, especially more males than females. They'll be in denial that they're truly having a heart attack. They don't think it's nearly as bad as it is. They don't want to go to the hospital. They don't want to bother anyone. They're in denial about what's going on with it. Another form of denial that I have seen is that sometimes we have a patient that's very critical, or maybe we're even doing CPR. We have someone in cardiac arrest and we're doing CPR, and the family comes to us and say, just tell him that we'll be at the hospital when he gets there. We're going to go on, just to let him know that when he gets there, to have him call for us. And I don't think the family is fully processing that he's in cardiac arrest. This is extremely critical. He may not make it to the hospital alive. So they're in a little bit of denial about that. Another reaction or emotion that we see many of our patients and the family of our patients are in is anger. And sometimes they've kind of worked through the denial part by the time the EMS crew gets there. So now they're very angry. Somebody has run a stop sign and boom, T-boned them. They get out of the car. They can't believe this just happened. And then they get very angry about it all because they're going to be late for work, or they could have missed picking up their kid. It's just frustrating. Their car's destroyed. And we show up about the time they've really gotten their anger worked up. And oftentimes we get to be the brunt of that anger. It's not directed at us personally. They're angry about the situation. We just happen to get there when they're very angry. So just remember, they're not angry at you. They're angry about the situation. And that's one of the cool things about EMS, because this is when we get to help them when they're having one of these really bad days and hopefully make it a little bit better for them. With the next stage of bargaining, there's not a lot that we see with that, but we will see sometimes with patients, especially again if the family member is very critical, that they start praying and just saying, please let me get to the hospital. If you get to the hospital, or if you do this, then that, and we'll see a little bit of bargaining happening. If it's been a more long palliative care type patient, they may have already worked through their bargaining. They may be in a little bit of the depression and sadness when the person has passed, and then eventually, hopefully, you will resolve all of these. You'll work into a stage of acceptance where you just sort of move on with your life. So again, the 5 stages are denial, anger, bargaining, depression, and acceptance. Hope this helps you prepare for your tests.